Hello and good evening, everyone. Welcome to our 105th Blue Health Virtual Seminar. Blue Health Virtual Seminar is a platform that allows healthcare professionals to discuss current management updates of different health-related topics for better patient care. And this platform is brought to you by Blue Health Ethiopia in partnership with the Leukemia Group. I'm your host, Adam Getachew, and I am the CTO and co-founder of Blue Health Ethiopia. And it's an honor to have
current आपल्याला share करताना
it's an honor to have Dr. Varendra. I'm sorry for the pronunciation, Varendra, here with us. To give you a little bit background about Dr. Varendra, he's a chairman of Leukemia Group, group of hospitals, and chief joint replacement surgeon. Dr. Narendra is a renowned orthopedic and joint replacement surgeon and the visionary behind Pion's largest network of advanced orthopedic specialty clinic, Leukemia Hospital, which strives to make high-tech, affordable orthopedic care access to all. And he has received his specialized training at the esteemed institutions globally, achieving advanced expertise in robotic-assisted knee replacement and minimal invasive spine surgery. And also, he's also an influential consultant on international platforms. He has been a panelist at the Regional Forum on SAARC and Developing Asia, organized by the FICCI. And he presented at the India Medical Tourism Destination event in Dubai and Muscat, and is an MVT consultant at the Ethiopian Orthopedic Society and Traumatology. And he will be presenting to us on the topic of innovative practices in orthopedics. Thank you. I think I've taken enough time. So, Doctor, the stage is yours.
Yes, thank you very much, Adam, and a big warm hello to all of you and my colleagues in Ethiopia. I am Dr. Narendra Vaidya, as it was told earlier, and I'll be taking you through some of the advances in the orthopedic field. I'm practicing orthopedic surgeon and joint replacement surgeon for last around 35 years or so, and I represent Lokmanya Hospital as a chairman. And I have been holding that position for almost last about 10 years or so. No, it just share slide. So I have got a PowerPoint presentation which I'll be sharing with you, and just a moment for this. So this is our flagship hospital, photo of flagship hospital, which is a orthopedic center of excellence for about 125 beds, and we have got 5 more units in the western part of India, which will be which do most of the things are done in orthopedic science. I'll be talking about some of the things, some photographs of our hospital. We have done almost in last around 10 years, more than 40,000 joint replacement surgeries and 14,000 plus robotic surgeries, and very keen to do high-tech orthopedic surgeries whenever indicated in our patients. So these are broad milestones of our organizations. In short, I'll take it through, and tell you, 1972 we started Lokmanya, and 74 we started first unit, and then over years we have added all these units, 6 units in the western part of India. And this is brief about our hospital. It's a multi-speciality hospital at 2 locations, and rest of them are orthopedic focused specialties. We are number 2 in India as far as the joint replacement numbers are concerned, and we get patients from all over India as well as from other countries, including your country, that is Ethiopia. We conduct a lot of academic activities. We have visiting fellowships where people from India and abroad, the doctors, they can come to Lokmanya Hospital and study in various various branches. Presently, also we have ongoing programs in arthroplasty and spine surgery, as well as in arthroscopy field. We have some overseas fellows also, and there is some process linked to it. We have to apply to the medical council, and then the hospital also gives the license and certificate after passing this. These are all recognized by all the medical councils globally. So you can, anybody who is interested in learning about more about fields in orthopedics as well as industrial health. Then we have emergency medical services, we have anesthesiology, and then some of the other branches like radiology, etc. So we conduct a lot of academic activities, and this is today's evening is also one of the activities which we'll be conducting, which is mainly focused on academics apart from sharing our knowledge and know-how. We are accredited by the National Board of Hospital Accreditation, and we have got NABH, and all the hospitals are as per the NABH standards, and we have to follow all the infection control guidelines. We have to follow all the administrative guidelines, as well as some other things which are required, namely mainly it is infection control and operational excellence. It is a qualification which is higher than the ISO qualification, and we also have other accreditations in the local government is concerned. So Lokmanya offers services which are cost effective, and we give quality healthcare, and we are very much keen to have the cutting edge technology and all the alternative therapies as well. So it's a center which will actually provide the patient with all the care, starting from primary care and going up to tertiary care, from rehab, prehabilitation, as I say, to rehabilitation. So a lot of patient awareness activities are also conducted, common people activities. So we'll be talking today about innovative practices in orthopedics. As you all must be knowing, the science of orthopedics has advanced over last couple of years. Technology in orthopedics has improved, and the tools of surgery have improved, and the techniques. I always say this T3, which transformed the field of orthopedics from orthopedics, which was mainly a ancient science, right from the Egyptian times. It has actually transformed itself into a very high-tech science. And every day you will see that there are some advances in the field, and we all, as a part of the community, must be aware of all the advances which take place in the field of orthopedics. We started with simple conservative treatments, and now we have got minimally invasive surgeries. We have got minimally invasive incisions, and then technologies ranging from stem cells to robotic surgery. And I'm very glad to share that in Lokmanya, we are doing all sorts of primary to tertiary orthopedic cases, and now we've added robotics, which gives a different dimension to our patient care areas. So why the advanced techniques and technologies are required? And I think everybody knows about it, that it increases the precision and accuracy of surgery. It gives the minimum human error. We do the surgeries through very small incisions. So the recovery is very fast because there is very less soft tissue handling and less dissection, less ligament dissection, shorter stay, less chances of blood transfusions, better surgical planning, reduce risk of complications, enhance surgical control. Most importantly, the reproducibility is very important. So anybody who is the surgeon who does the surgery using the most modern robotic surgery, the results are uniform and the outcomes are uniform. So even if a junior resident doing a surgery or a consultant doing a surgery, the outcomes are predictable and outcomes are always as per the desired mark. The patient satisfaction is very high, and there is it's very unlikely to have the risks and the problems in the patient care areas. So we'll go to the first advance, and now many of us have seen this particular thing in their own field. In industry, the motorized industry, this is a established sort of a science, that is 3D printing. The 3D printing is very much there now, and now if we see in last 3 decades, it has actually from on table or just sort of a area which was academically sort of appealing idea now has got converted into actually a practical idea, and we are already using this 3D printing technologies in the field of orthopedics extensively. So it gives you the personalized implant. As you all know, everybody's bones and joints, they have different shape, different curvature, different area of different arc of curvature, and so many parameters which we use during the orthopedic surgery. No bone in the body is straight, and you will have some sort of curves and some sorts of angles for each area. And so it is very important that we give the person a personalized care in giving them absolutely well-fitting implants and prostheses. Another area which is very important is surgical planning. Half the surgery is done when the surgeon is planning about the surgical actions. And so, before even touching the patient, we can actually do the virtual surgery using the simulators, or surgical planning is very precise. We can have overlap images where we can actually put our implants on the bone and see the fitting and then play with it and then choose our implants which fit to the fit to absolute perfection in a particular patient's bone. Area of bone and cartilage regeneration also actually is covered by 3D printing when we do the scaffolding in cases of bone voids. There are many injuries which are open fractures. Then they are like, there are cancer. In cancer surgery, we remove the bone. Then there are bone voids or gaps in the bone. And that case, we have to use a scaffold which will be acting for bone and cartilage regeneration. And this is also very useful area where 3D printing of immense importance. We can design surgical instruments, implants using 3D technology, and that is also actually custom made and quite now commonly used in difficult areas like pelvis fractures and tibial plafond fractures, ankle fractures, elbow fractures, all intra-articular fractures, curved bones like clavicle. Then we can actually have all the surgical instruments which are specific to the patient and give them better outcome. It is also important in educating and training of the residents. Now we can have simulators and 3D printers, which person can play on the computer screen to do a virtual surgery, and definitely it is extremely useful for the surgical practice. We can do all sorts of fracture fixations and bone reconstruction using 3D printing technology. Post-operative monitoring also becomes very effective, cost-effective, and efficiency is also very important. And we have continued research and development in this field. Every day there is some additional thing which is added in 3D printing. So it is going to be the area where orthopedics is going to grow towards. And definitely our patients in coming years, whoever needs orthopedic implants or joints or custom made joints or tumor prosthesis, this is going to be of immense help to our patients. So, as I told earlier, with the increasing complexity of operations and surgical decision making, three-dimensional printing is a novel modality with the potential to make a huge impact on the surgical field. 1984, the first 3D printer was filled with in United States, which was an apparatus for production of 3D objects with stereolithography, which was in effect the world's first 3D printer. First reported use in orthopedics was long back, that is 2 decades back, that is in 1999, as an aid of pre-operative planning complex spine surgery. In this, we used to use a 3D model of spine. We could use it on the computer, or you can have actually a model made in plaster of Paris or rubber like materials. And then it was like a mannequin, and then do the surgery on that. As you all know, the surgical training types and surgical training methods have also changed, and which right from intravenous cannulization to catheterization, labor, everything now can be done on simulators and mannequins. The same way we used to use these products for planning of our surgery pre-operatively. 3D models allowed the surgeon to predict the intraoperative difficulties, The contouring of implants, as I told earlier, no bone is straight, and so we had to contour our implants. So pre-operatively, we could contour the implants absolutely to the perfection so that they were absolutely well fitting, without any jutting out of the implant, without soft tissue rubbing, or dreaded complications like perforation of soft tissues, or irritation of ligaments, or any other things like that. So we can use these models for training and do a pre-operative templating, and definitely that was of a great advance. Initially, this was only limited to pre-operative planning, but now actual implants can be actually manufactured using 3D technology, printing technology, and we can have 3D patient-specific instrumentation, and this can give you a complete accurate implantation of the desired part. And so this is on the rise now, and any difficult situation, we are able to use this kind of technology. For example, after a hip replacement, sometimes the patients requires revision surgery, in which there are bone defects. There is a void in acetabulum and void in the femoral side. The bone defects are there. So with 3D technology, 3D printing technology, we can actually virtually see these defects. We can plan for the implants, or we can make the prosthesis like a acetabular cup, or we can have a custom made plates with 3D printing technology, so that the defects in the bone were tackled very, very effectively and very, very efficiently. So we can now use practically in our patients the technology initially, which was only used for our pre-operative planning, can now actually be part and parcel of the surgery, where surgeon, along with this technology, they can actually give the optimum results to our needy patients. So how it works, like I told earlier, the 3D printing converts a computer generated three-dimensional image into a physical model. This model creation is based on DICOM 3 format data derived from a CT scan or a MRI. So you take a CT scan or a MRI, convert into a DICOM image which is three-dimensional, and then that is then there is a command given to the printer, that is a machine which is going to give you a 3D model, which will be given to the surgeon pre-operatively, which will enable the 3D reconstruction of the image. This is exported in a file format, stereolithography STL, making it readable by software, which is used to 3D designing of the objects. Defects or errors in the STL file are corrected and before exporting to the 3D printer. These printers additively manufacture or create the objects layer by layer, and making it to the perfection. So you can see some of the examples. This is a very difficult elbow case in which the lower end of humerus has malunited. It has united in a wrong position, and we have to correct the deformity, in which we can template it and prepare the implants to the perfection, and then just implant it, so that there is no proud ligament, or there is no proud implant which rubs on the ligaments or pokes the soft tissues. Another difficult situation in which there is a hip defect, pelvis defect, in which we can have that model, which you can see on the right hand side lower images. So this is made from POP like material, and then the surgeon can have access to this, and then you can virtually fix this, or you can prepare the implants and be very comfortable and accurate on the operation table. So these are the kind of images which a surgeon will get, and this is kind of a model which a person will get and a surgeon will get, and then you can contour your implants accordingly. Another area where 3D printing is of immense help is the upper end of humerus fracture, where you can pre-contour this kind of implants, which are short implants or long implants, and fix the fracture of the upper end of the humerus. Even if it is a four-part fracture, with the locking plates, you can beautifully fix it and give a complete range of movement to the patient, and that prevents the replacement of the proximal humerus in cases where the upper end of the humerus is shattered, having three or four part fracture. In earlier years, we had to just go for a replacement of this with a NIRS prosthesis, and so patients used to have a lot of limitations, like he was not allowed to lift a heavy weight, not allowed to do manual work, or not allowed to drive two wheelers, or even bigger vehicles also, like the trucks or things like that. And then we can now preserve the bone, and we can actually give the patient complete freedom of movement. So this is application in shoulder. This is application in the fractures of clavicle, where you can see S-shaped contoured plate which can be 3D printed, and the patient can be actually operated beautifully with this. We're using a MIPO, or a minimally invasive technique. So you can see just two small incisions on the clavicle, and you can slide the plate underneath the skin, just fixing it on the bone. So you don't have to dissect the entire clavicle, you don't have to denude it, you don't have to take out the sternomastoid, and so all the functions of the neck and shoulder girdle muscles are preserved. So there's the great advantage in curved bones like clavicle. Along with the 3D printing, another area which is growing by leaps and bounds is the augmented reality and virtual reality in orthopedics. So the name itself suggests the actually the modality. The augmented reality means the doctor will be using a wearable technology, where there is like in video games of the kids, there will be glasses which like Google glasses the surgeon will use, and then the surgeon will get a virtual image of the bone which is going to be operated on the screen itself, and you can superimpose that particular image during surgery on the bone, and so you can get actually augmented reality. That is called as augmented reality. So there are technologies like HoloLens which are now available readily in India. We have been using it for difficult replacements, like in shoulder replacement. We can use for knee replacement also. So virtually we can actually superimpose the MRI or a CT scan image during operation on the bone to be operated, and so there is no mismatch as such. So augmented reality increases the precision, it increases the accuracy. It has got a huge value as far as the training of the skill development of the surgeon is concerned. Improved patient outcomes are definitely a great advantage. This is a very cost effective method. It is a reproducible method where we can use it to the great effect, time to time, again and again, and give our patients a sort of predictable outcome. This is also useful in patient education as well as in patient engagement programs. So it has some effect on patient conversions for surgery, where patients can use this augmented reality. And some of my patients, we tell them in the counseling room that you can do the surgery, so their confidence level for surgery also goes up. So they will be actually wearing this sort of goggles, and they will see the image of the knee replacement bones to be on the screen, and they can virtually lift the instruments, use the saw virtually, and do the bone cuts when required as far as the knee replacement is concerned. So you can actually virtually do the surgery without actually cutting the bone, and that helps in patient education as well as in pre-operative planning. And then use the augmented reality for our surgery actually, and increase the outcomes, also increase the positive outcomes. Another area which is very much growing, and you might have heard and read about this technology, is the emergence of stem cells and biologic therapy. This is called as orthobiologics, biologics in orthopedics. Till date, we have been ignoring the biology. There is a sentence which is written by Campbell in his textbook for orthopedics, that bone is not like a wooden piece where a carpenter fixes the wooden pieces, but you have to be like a gardener where you actually grow the wood, and you can actually, that's the most important thing. You have to take care, your hands have to be gentle, soft, but at the same time, we should not disturb the biology of the patient. And that was the thought process here. Bone, like any other tissue in the body, is a living tissue, and so you have to take care of bone healing, tendon repair, damages of the ligaments, all can be repaired using this particular stem cell and biologic therapy. It is also very much useful in spinal injuries. As you know, the spinal injuries have got a very guarded results, especially when there is a problem in problem like neurodeficit in the patient. Then these cases, we have to use stem cells to regenerate the spinal cord nerves or cells. This is still in research phase, and people now are using it to the more and more numbers to advantage of our patients. In cases of muscles, we can use stem cells, and there can be regeneration of the muscles. Again, this area also, there is some advances which are going on, and we have to still wait for the optimum results in some of the cases. This is very useful in cases of muscular dystrophy, especially in pediatric cases where a patient has got Duchenne's or Duchenne-like muscle dystrophy. And dystrophies definitely, or in cases of cerebral palsy where muscle degeneration is there, nerve degeneration, then stem cells are proving to be of great help. So this is going to be future of now orthopedics now, and definitely regenerative therapy, orthobiologics are going to help us in treating our patients. So what are the stem cells? We hear this terminology stem cell very often, and we have to understand what are they. As you all know, the body develops from a single cell, and from that cell, one cell, entire body develops, and that cell is called as a totipotent or uncommitted or multipotential cell, which can transform itself into various types of tissues and cells. First cells and then tissues. So these uncommitted cells with the capacity of for unlimited or prolonged self-renewal and ability to give rise to differentiated cells under appropriate conditions. So this is the catch, that differentiated conditions still we have to actually understand. So this conditions, say for spinal cord growth or for muscle growth, they are different, and so the science is still exploring this particular mediums where this particular, say, stem cells will get transformed to a particular type of surgeon. That control is still not very clear, and so we have to do more and more research in this. So now this unlimited capacity, prolonged self-renewal, we have to prepare these differentiated cells. Then it takes, from unipotent, we have to do these multipotent cells. We have to appropriately grow a particular cell line. So in orthopedic surgeries, we can have this advantages of natural healing, like in a patient of non-union or delayed union of fracture. We can take these multipotent cells, put it in the hematoma and fracture hematoma, and then these cells will get transformed into osteoclasts and osteoblasts, and then create new bones as if it is a natural bone. And this reduces the inflammation, the recovery is faster, the bone unites faster in fracture cases, and of course these cells are given in the injected in the particular area with a small needle, like a bone marrow aspiration needle, and so there is a very minimally invasive outdoor procedure. So it's being used more and more commonly. We are using this stem cells from either the source is adipose tissue from the abdomen, or you can have this totipotent or multipotent cells from bone marrow also. Then you can have this centrifuge and create a high concentration of this particular stem cells and inject in a particular area. The second method is to take it out and then stem cells, and then you can process it in a particular medium, cell medium, and create a cell line like we use in cartilages. We take out a cartilage cell, grow that cell line, and then transplant it inside the joint where there is a cartilage defect. So it gets converted into cartilage tissue. So these are the various types of using the stem cells in needy patients. So we have a couple of orthobiologics which are already there in the market. Platelet-rich plasma, which is very commonly used nowadays, that is called as PRP treatment. The platelet-rich plasma, again, that will patch the bone cartilage defect and help the local tissue to grow the cartilage, and so the hyaline cartilage in the joint gets repaired, and sometimes it can go towards the fibrocartilage, which is again over years getting transformed into hyaline cartilage, which is the natural cartilage in the joint. So we can use the PRP to a great advantage. This is again an outdoor procedure where patient comes in. We take about 20 cc of blood from the patient's vein, and then it is centrifuged in a particular environment. And that particular platelet-rich plasma is then, through a special delivery system, it is injected in the joint. We separate the plasma from, we take out the upper layer of the plasma and separate it from the high concentrate of platelet, and that's why it is called as a platelet-rich plasma, and then it is injected inside the joint. So how it works, the stem cell therapy. So stem cells are isolated, concentrated, injected in the injured tissue. Once in the body, the stem cells start stimulating the tissue repair and regenerates the damaged cells and reduces the inflammation. It can be used in osteoarthritis, ligament and tendon injuries, conditions like frozen shoulder, rotator cuff tears, ACL injuries. It is very much useful. We can use it in bone fractures. So it helps in healing of the fractures, delayed or non-union of the fractures, spinal conditions like degenerative and disc lesions. Benefits are numerous. It regenerates the damaged tissue, promotes the healing by enhancing the new natural repair process, and reduces the need for invasive surgery or joint replacements in certain patients. Potential for regeneration, tissue regeneration is really great, and that helps in chronic conditions as well, like in osteoarthritis. So this is about PRP and stem cells. So we are using this very often. This is a OPD procedure, outdoor patient procedure, where it is done under all aseptic precautions, and we use this to the benefit of our patient. So this is a small animated video
The suction
where you
activated
can
GraphNet
see,
device is designed to collect
we
autologous
can see
tissue
that
for a multitude of applications.
we can see that this particular tissue collector is there, which we collect the cartilage. This is a sort of a handpiece or shaver which is used inside the joint, and then you go on the diseased surface and diseased cartilage or injured cartilage, and you can see that we are cleaning it to the subchondral bleeding bone, and then take out some cartilage and tissues from the non-weight bearing portion of the joint, and this is then transformed into a particular device where we can culture these cartilage cells, the chondrocytes, and then it is optimum concentration is prepared. It is then mixed into plasma, and then cartilage particulate, it is mixed with plasma, and as you can see, this autologous fluid and concentrate is then plastered over the diseased surface, and then a blood clot is placed on top of it, so it seals itself and gives a beautiful sort of cartilage regeneration. So this is again a sort of daycare procedure where a patient goes home. You have to keep the patient non-weight bearing, and then after the cartilage regenerates, the patient can start bearing weight on that particular leg. The same can be done for the hip pathologies, or it can be done for ankle pathologies, and the cartilage can be actually transplanted to the area where there is a cartilage defect. So this is going to be of great help, and today, whatever joint replacements are there, probably a day will come when we replace the entire joint replacement procedure itself with this modern technology of stem cells, or this particular cartilage can be actually transplanted, and this will be definitely replacing the joint replacement surgeries in coming few decades. So another this slide here where it is showing a sort of flow diagram where you can see that how the regenerative medicine is going to transform into patient care activities, and we can have this cell regeneration, and you can use it in the patients according to this particular flow diagram. The advantages of stem cell therapy is that it is a minimally invasive procedure where most of the times, as I mentioned earlier, it is a injection which is used, and then there is no sort of surgical procedure which is required. The recovery time is almost immediate, and a patient can go home immediately and start his activities very early. Tissue regeneration is actually the way forward, and this will reduce the areas of complications like infections in joint replacement, etc. BMAC is another area where we are using this to more and more numbers. Bone marrow is aspirated or drawn from the patient's pelvic bone, the iliac crest, and then processed to concentrate the stem cells and growth factors. The concentrate is then injected into the injured area, like fracture sites or in cartilage defects and soft tissue, inflamed soft tissues, and this can regenerate the bone. This is very useful in a condition like avascular necrosis of femoral head or talus or scaphoid, where the bone is started necrosing and there is a pre-collapse condition. Then you can use BMAC and create a new scaffold of the bone and have the actual bone regenerated there. So this is of great advantage. We have to just do some drill holes in the bone and then inject this inside the bone where the defect is there. And this is again a very interesting area where science is going to grow. So growth factors are also of great help, and these are the factors which regulate the cellular process such as growth and healing of fractures, regeneration of tissues, etc. Some of the most commonly used growth factors are VEGF or fibroblast growth factor, then vascular endothelial growth factor, transforming growth factor or TGF beta. Growth factors can be isolated from patient's blood, bone marrow, or tissues and then injected into injury site to promote the tissue repair and regeneration. It is used in cartilage defects, cartilage injuries, bone regeneration, sports injuries like meniscal or cartilage injuries, ligament or tendon injuries and inflammation, fracture healing, etc. And it stimulates the tissue regeneration and helps in cartilage repair. So this is again going to be an area where it's very interesting. So once we have identified the area of damage, you can use the cartilage substitutes, the chondrocytes and cartilage cell lines, and then inject growth factors also along with it. So it is going to have a sort of a catalyst effect in creating the new tissues. Hyaluronic acid is an artificial sort of drug, which is not a natural thing. And hyaluronic acid can be used to restore the joint lubrication, which reduces the pain and inflammation inside the joint. The uses are in osteoarthritis, joint pain, and stiffness. It improves the joint lubrication, reduces the pain, and delays the need for joint replacement in some patients. It is again a daycare surgery. The injection is administered in OPDs, the outpatient clinics, and often performed under local anesthesia. Another therapy which is going to have some sort of impact on orthopedic surgery, like exosomes, which are tiny vesicles or non-particular, particles, so which is secreted by cells containing proteins, lipids, and RNA, and this can influence the cell communication and promote healing. So it can be used as adjuvant therapy to stem cells. So both can be used together, and again the applications are vast, and you can use in joint healing, that is osteoarthritis or tendon ligament injuries or muscle regeneration. It again enhances the tissue regeneration, accelerates the recovery, and again it is a very minimally invasive or non-invasive sort of procedure. Orthobiologics increase the speed of healing, reduces the pain and inflammation. It avoids the surgical treatment and minimally invasive treatment. Most of the medical practitioners can use this in our needy patients of osteoarthritis, rheumatoid arthritis, etc. In patients of tendinitis, like patients in plantar fasciitis, tennis elbow, all these orthobiologics are of great help, and they have a very good long-term benefits. Another area which is going to grow is the wearables. That is there are monitoring devices which a patient can wear on the prosthesis or on the plasters or splints, and they can detect the early complications. They can help in enhance patients' engagement, adherence. They can help in gathering the objective data for the healthcare providers so that we can plan the physiotherapy exercises to a great precision. it can give a personalized rehabilitation program for the patient because the surgeon is continuously monitoring. In easy words, this particular device is worn by the patient over the splint or over his dressing, and patient goes home, and every day you can monitor the patient's activity levels like the steps walked or the range of movement of the joint after joint replacements and the procedure, and we can have actually ongoing data which is available. It can also give data about the muscle strength, the overall recovery of the patient in terms of steps of walking, activities like stair climbing, chair rising, etc., and that can give the actually personalized program for the patient for rehabilitation. uh, this also reduces the need for actually in-person visits because remotely you can monitor the patient's activities. So even if patient is in other country, you can monitor it on your mobile phone and see the data. You can prepare various graphs, so trajectories, so we know exactly the way the patient is progressing. Like for example, 1 week back, suppose the patient had 90 degrees of flexion. Today we know that the patient's flexion is increased or decreased just to looking at our mobile phone, and then tell our physiotherapist to alter the physiotherapy plan according to the need. Also, the muscles strength also can be monitored over the device, and you can then advise the particular exercises as the patient needs. This increases the patient confidence levels and increases the patient and doctor, improves the patient and doctor relationship also, because in today's world there are a lot of problems as far as the patient doctor faith and relations are concerned, and this device definitely can help our patients to have more confidence in the healthcare delivery system. Objective trackings of recovery milestones also can be done. Like for example, patient could drive a vehicle, or patient could ride on a bicycle, or patient could go say 100 steps on the stairs. So everything can be monitored, and then according to that, our rehabilitation program can be altered. So there are like smart braces, as you see on the picture. There are smart devices, sensors, motion sensors, small insoles, wearable pain management devices like pens, that is a percutaneous electrical stimulations of the nerve. These are going to be of great help in the rehabilitation of the patient. So these technologies are going to grow, and like I always say, that patient care is not only the index surgery, but patient care starts from prehabilitation to rehabilitation. And 1/3 of the patient's management and satisfaction is going to be depending on your post-operative rehabilitation. And that is where these variables in the orthopedic recovery are going to be of great help to the orthopedic surgeons and the patients alike in the coming future. Now we'll go to the actual surgical part of it, where today with the most modern devices and most modern technologies, the surgeon is doing most of the surgeries with the minimally invasive technique, in which there are smaller incisions, so there is reduced trauma to the tissues, there is faster recovery and shorter hospital stay, and low risk of infection. The cosmetic results are also good, and then they have less muscle and joint stiffness. The precision of the surgery just goes up, and the visualization of the concerned joint also is better. So you have less risks of complications, less need of post-operative pain management, and it is very cost-effective method because it's mostly a daycare management. So the patient can be sent home immediately after operation. So the MIS, or minimally invasive orthopedic surgery, is the way forward, and we have already been using it for a long time. Like for example, in fields of sports medicine, almost all the injuries now in the knee, hip, shoulder, they can be tackled with arthroscopy. And it's like a daycare procedure where we tackle almost all the ligament injuries, meniscal injuries, cartilage injuries, etc. Most commonly, minimally invasive surgeries, apart from arthroscopy, are in joint replacement surgeries where we have smaller incisions now, and we just resurface the joint with the other technologies like robotic technology, or in spinal surgery with the endoscopy, we can tackle most of the spinal problems like disc prolapse or internal decompression of the stuff for spinal stenosis also can be done with endoscopy. We can do fracture fixation in a minimally invasive way using the MIPO technique, and even the tendon and ligament injuries, carpal tunnel release, which is also done endoscopically. So most of the things can be tackled on the with a minimally invasive approach. So it reduces the trauma. It is done through a smaller incision, and it reduces the complication rates also. And of course, the recoveries are very fast and improves the cosmetic outcomes because the scarring of the tissues is very less. So this is a radio frequency device which we are using during surgery. It is called as coblation. You can see a cartilage defect with fibrillation of the cartilage, the patella. And with this ring sort of coblation device, you can smoothen the joint, which will avoid need of joint replacement or patellofemoral replacement. It is extremely precise surgery. It improves the accuracy. It is, helps in minimally invasive procedures, and you can have better outcomes and faster surgical time. So intraoperative, we can do all these kind of surgeries as we have already seen. It's a repetition of the slide. Another area which will be helping our surgeons is to make use of telemedicine and remote monitoring. Nowadays, it's like a global village, and patients travel from one city to another for patient care and surgical treatment. They can go from one country to other, like in medical tourism. And here, the need of patients monitoring is very much enhanced by use of telemedicine. Because it allows remote monitoring of the orthopedically operated patients. It improves the access to care. It reduces the healthcare costs, traveling headaches, and traveling, time also. It enhances the patient engagement and compliance because you are constantly in touch with the patient, and surgeon and patient can have dialogues over telemedicine. Now the technology is also getting cheaper, where you can actually use a simple device like your mobile phone. You can use your laptops and desktops, and patient can be monitored from miles away. So now we go to another area where we go to the field of orthopedic or arthroplasty, that is joint replacement, where we are using this with 3D technology, printing technology, patient-specific guides, which improves the precision and accuracy of surgery and the bone preparation. It is again used in minimally invasive surgery. It improves the patient outcome because it gives you a custom fit, and reduces the risks of radiation because you don't use X-rays or CT scans in this particular technology. It is a very cost-effective technology, and it gives you the better patient outcomes. So use in orthopedic is in total knee, total hip surgeries. You can have spinal screw placements also with this particular technology. You can have custom plates or jigs also with this particular patient-specific jigs or patient-specific guides and cutting blocks. And you can have complete sort of deformity correction even in grotesque deformities or very high deformities. The latest feather in the cap is of robotic surgery. It is used more and more often in orthopedic surgery, and now we are using it almost in all joint replacement surgeries since last about 8 to 10 years. And we have crossed 14,000 mark, which is highest globally, and that is a number which largest series Lokmanya has. And almost all the joints can be replaced. The knee joint, of course, you can do total or partial knee replacement with robotic technology. You can do a hip replacement with robotic technology. Even shoulders now also very in near future. In near future, we can use robotic technology for shoulder joint replacement as well. So this is a ROSA machine which is used for our robotic knee surgeries. It is a Zimmer machine, and we can use it in our patients requiring joint replacement. So you can see an animation for osteoarthritis where articular cartilage as the age increases starts getting degenerated and gets worn off, and then your meniscus also is worn off. leading to an inflamed and painful joint. And then our task is to replace the diseased cartilage. Now, the earlier types of joint replacement, we had to remove a lot of bone, we had to put stems, we had to use intra-articular aligning rods, and that's what made the surgery more invasive. But now, with the latest robotic technology, we can map this joint surface, which creates a virtual three-dimensional image on the computer, and then you have to just burr off the diseased cartilage. So in robotics, you make use of virtual reality also, augmented reality also, and then you have the very precise operating tools which are in the hand. These are like intelligent instruments where the surgeon can control these instruments, and these are only in action when you are actually applying it to cartilage. So you don't damage any normal soft or hard tissues like bone or ligaments. So this is a preoperative gait of the patient which progressively gets damaged, and the patient will start waddling after a certain time. And then you can use your variables to assess the preoperative gait. So surgeon knows the preoperative conditions of his muscles, as well as you can know the details about bone defects also. The same information is then transformed into robots, and these are various types of robots in this picture, from generation first to generation fourth. All these four generations of robots are available with us at Lokmanya Hospital, Pune in India, and we have been doing all the joint replacement using this technology. So the robot will place the jigs in ROSA system, where a surgeon will be handling this robot, and then a very precise jig placement is there. It is a planar haptic where you can move this robot in the same plane, but the plane of the cutting of the bone doesn't change. So you get very precise bone cuts and joint replacement surgery. Another generation, the second generation of robotics was Navio robot, in which we used to map this, and robot used to create this particular three-dimensional virtual real-time image of deceased bone and cartilage, and you can view this from all three angles, all three planes. You can actually ascertain the various angles of the bones and then start milling or burying the bone, where you can just take out the cartilage of the diseased portion, diseased bone, and then you can fit the implants. So this particular handpiece will have a rotating burr which can be operated either in exposure mode or speed control mode, and then you take out this cartilage. So this is a real-time three-dimensional virtual image which is color coded, where you can see red area which is about 3 millimeters, blue is 2 millimeters, green is 1 millimeter, and white is what the bone surface actually is intended to reach. So we remove all this particular diseased cartilage with the help of just burrs. It is like shaping the tooth in case of dentistry, where the tooth is shaped by the dental surgeon with a burr, and then you can fit the cap. So it's the same thing which can be used with a intelligent handpiece of robot, and then you can have this partial or total knee replacement. And you can see the graphs of movement, graphs of ROM, which are actually coming on the screen of this particular thing. And this is the real-time intelligent instrument which can be used on the bone. This is the only instrument which has to be used during surgery. There is a burr, and you can see the sensors on the burr, and these sensors will communicate with the robot with the help of infrared rays, and this gives absolutely complete precision in preparing the bone surfaces, where you can make even the lug holes also, you can make the burrs, or you can make the chamfers also, and then put this particular component inside, and then fit the implants and cement it in place and get an absolutely perfect sort of alignment. This is another robot, which is a Cori robot, which is again using a burr technology, where the surgeon will have a three-dimensional virtual image after mapping of the bone, and use this burr to create a sculptured sort of a surface of the bone. So you put this sensor pins, then you put the sensors on the bones, and then take the knee through range of movements, and then start mapping after you put the control sort of pointers. Then you take measurements of the particular designated area of the bones, that is the malleoli. You can map the knee also in the on the tibial side, on the femoral side. Then you can start, collecting the data of the hip range of movement so that you can get the axis of the knee which is perfectly in alignment. That is the zero axis, what we call, and you get a perfectly aligned sort of a limb. After that, we start mapping the bone like it is similar to the Navio robot, and it will create a complete three-dimensional virtual image of the lower end of femur and tibia, and then start burying the portion which is actually deceased portion of the bone. The beauty of the system is that you can actually virtually see how the implants are fitting on the bone and move these images all in three dimensions and directions. And after that, you can get these graphs which are actually indicating the soft tissue tensions also. And then you go on balancing the knee and have it perfectly balanced in flexion extension and mediolateral planes as well. Again, reconfirm that your sensors have not moved, and then proceed for burring of the particular cartilage surface. So you can see the burr is taking off all the extra bone, and it is preparing a nice sort of a femur which can be cemented, and then after that you can actually put the cement, or you can use a uncemented implant also, and then fix it to the native bone. So these are some of our patients where you can see a very bad osteoarthritis with almost 30 degrees of varus in 30 degrees of varus, and then patient was taken for bilateral knee replacement. After this, patient is able to travel through a public transport train, and you can see that he is able to manage all his deformity, all his daily activities on his own. The same patient now in a very crowded road traffic conditions also is able to drive two-wheeler, four-wheeler, and is independent of all aids. This is a patient with ankle knee deformities with a stiff hip who was having a completely stiff knee, and we had to do a bilateral knee replacement. We used the Cori robot in this particular patient, and the patient after surgery is now able to walk independently without help of a walker. You can see the patient who was a burden to the family becomes a aid or help in the hospital or in the house, and she can do all the activities on her own. Another patient with bad osteoarthritis, deformity, varus deformity, where the legs are buckling up and the patient is walking with a waddling type of gait, where we did a bilateral replacement, and the patient now is in action fully on her own. Another bad patient with bad knee on the left side, you can see it's almost getting subluxated completely. There is lateral thrust of the tibia or femur, and patient has to use two crutches to walk, and which is very dangerous for the patient because anytime the knee will subluxate and or otherwise get fractured, and the patient will have a very big sort of a morbidity. So we operated this patient, we did a bilateral knee replacement, and after surgery, the patient is able to walk without any pain, without any walking aid, and she's able to do all the natural activities. Another patient where a patient is having bilateral hip and knee problem, where we had to do both hip and knee replacements, and after hip and knee replacement, the patient is walking as if the patient is in military, and he is completely back to normal gait. You can see a great transformation in the life of this patient, and we can give the same type of results using the most modern robotic technology in Lokmanya Hospital. We have the patients which are actually poor patients and patients who require this high flexion of the knee, and this patient particularly is able to is a farmer and stays on a farmhouse of her own, and she had to do a lot of farming activities, when she was young, but as she grew older, the knees got degenerated and patient had a problem in walking. After replacement, now patient is completely able to do all the very difficult tasks also, like climbing on this cliff or going on the farm, doing her own work on the farm. So patient is back to normal. Patient can squat down, patient can kneel down, Patient can do these religious activities like going for a namaz prayer or something like that. And you can see that the patient is completely independent of any sort of activities. So to summarize, we have now technologies which are like, most modern technologies which will be giving patient his preoperative sort of motion which is restored in the patients. We have technologies like dual mobility technologies in hip replacement, where patient can do high flex activities in hip replacement also, which enables patient to sit or squat on the floor. Patient is able to sit cross-legged, and this is a great technology which is going to grow very fast in coming future. So this is one of the patients with a hip avascular necrosis. All the conservative methods had failed, and then we did a bilateral hip replacement surgery. A patient was a wrestler, and then patient is now back to his own activities now. Another patient where patient was having a severe deformity of the hip joint, there was limping, and you can see the patient meditating now and sitting in cross-legged position after hip and knee replacement. Another patient who came from Dubai for treatment in our hospital. Patient's hip replacement was done, and patient now is able to kneel down, and patient is able to even sit cross-legged also. So you can see that the joy of motion, joy of movement is completely restored in our patients who are, having very bad deformities, very bad preoperative gait, and definitely the advances in science of orthopedics help our patients to go back to their pre-operative working levels. So thank you very much for having me for this particular program. And I'm sure that I was able to share some knowledge with you all, and hope to see you in further continued medical education seminars and webinars. Thank you very much. Over to you.
All right. Thank you very much, doctor. So maybe if there are a few
Madam,
questions
I
you
am
have.
done with my presentation. You
Yeah.
can take it up from here.
Okay. Okay. If you have time, we can proceed with the questions if there are any. If not, we can. There are no questions right now, but I say a lot of thanks from our participants. All right, Dr. Narendra, it was a pleasure having you here. Thank you so much on behalf of both Blue Health Ethiopia and on behalf of our participants. We'd like to thank you to giving your time to to update us on such important topic. Yeah, and I think he has already left, so I would like to thank you.